Hi, welcome to Infinx's Office Hours. I'd like to thank our audience for attending. I'm your host, David Byrd, and today's topic is enhancing reimbursement outcomes for orthopedic practices. I'd also like to thank our guest, Lora Pada, AVP of Customer Success at Infinx. Lora, thanks for joining us today. Before we begin, happy to have you here. Before we begin, why don't you tell the audience a little bit about yourself, how long you've been in Infinx, and how Infinx defines customer success?
Sure, I've been here for a little over 5 years. So overseeing the customer success department, we are responsible for onboarding new clients, implementing them, getting them onto our solution, onto our platform, and then just helping with the day-to-day questions, answers, basically anything, any question, any issues, anything that arises, your customer success team is here, is our responsibility. So really working in tandem with the operations group, with our product group, sales, super cross-functional.
So you're touching every department within the organization, essentially.
That's about.
All right.
Marketing, everyone.
Marketing, everyone. So first question I have for you, according to the American Board of Orthopedic Surgeons, there's about 30,000 board certified orthopedic surgeons within the US. And according to the American Academy of Orthopedic Surgeons, there's about 54 million musculoskeletal procedures performed in 2022. So the first question I have is, how do you spell orthopedic? With an A or without an A?
That's a really good question, David. I use an S, but it also depends on our clients. Sometimes they have orthopedics with an E or an A, but I'm sure you know the background. What's the history behind the A and the E?
I do know the background. So you spell it with an A, that's derived from Britain. So when we first came over and the orthopedic practices, specialties started to get established, we took that spelling from the British, and then over time, we took off the A. So it's kind of like how it's not.
Fun fact.
It's trivia, right? So.
Right.
All right. All right, we're off to a good start. So before we dive a little bit deeper into the topic at hand, can you just go over what your experience has been when you're dealing with the patient access department? What are their responsibilities? What do they do day in and day out?
So I have to say it depends on the client. Sometimes it depends on staffing, who they have. Sometimes they have dedicated staff members doing one particular task. So, for example, there's usually a team who does scheduling that could also they also could do prior authorizations. But basically, they're responsible for appointment setting, scheduling, registration, check-in. They're also, collecting, updating, re-verifying the patient demographics, their insurance details. They're helping with check-ins, providing them with all the details that they need for their appointment arrival. So if they have to have, come in with their previous x-rays or whatever the case may be, we're just kind of setting them up for success when they do walk in. So nothing's forgotten and the appointment doesn't have to be rescheduled. Definitely doing the insurance eligibility verification checks. So that includes, reviewing the coverage details, co-pays, deductibles, to help ensure that proper billing happens on the back end and then they get reimbursed. Obviously, prior authorizations are huge, making sure that, a lot of them have a dedicated FTEs in terms of just getting the authorizations, obtaining patient pay estimations. So what they are going to be expected, what the patient's going to be expected to pay. This also goes in line with the No Surprises Act, in terms of what they're expected to pay at the time of service, if there's any out-of-pockets due, et cetera. Again, prior authorization insurance discovery, which is somewhat new on the front end. It's, been heavily used on the back end, but being able to verify, sometimes some of these patients don't know if they have additional insurances or not. And so this is a way for us, helping our clients verify on the back end whether or not insurance is actually valid or if maybe they have secondary insurance as well.
So what I hear you saying is there's a lot of activity up front to allow that patient to get care that they need.
Yep. And then, a lot of times too, even at check-in, once they arrive, collecting those patient payments, getting those co-pays, getting the time of service it does help with the revenue as well versus, setting a bill at a later time or just not getting paid and having to write it off. So seeing some of our current ortho clients, making sure that they are collecting those patient pay estimations prior to the time of service is actually super critical.
So one of the things that you mentioned is prior authorization, and having been exposed to orthopedic practices and you working with them day in and day out. Can you kind of walk us through orthopedic groups, how they get approval for the prior authorization and how that affects downstream revenue?
So we do various types of approvals for authorizations for ortho groups. I mean, there's advanced imaging, MRI, CT scans. They do, some of them have a lot of PT/OT clinics, DMEs, obviously the surgeries, viscos, injections and infusions. Those are kind of like the main ones. And it's a mix. Some of them can do all of them. Some have their own imaging facilities. Some of them, refer out. So it depends on the ortho practice, but we definitely do get the approvals for the various modalities that they do have. In terms of how it affects the downstream, it definitely helps, with the revenue delay. So by getting the authorizations, making sure that the authorizations are on file prior to the date of service or prior to them coming in is super critical. It helps with the administrative burdens because a lot of this stuff, especially prior authorizations, are super time consuming and they do require a lot of staff, just dedicated, just getting those off. So that can definitely help just, sometimes that's, the point of why a lot of them outsource to us is because one, we can handle the, scaling with them as they add providers or they do acquisitions. We can help scale with FTEs and with the automation. Our AI, machine learning, all the tech part of it. It also helps with, the denials and the appeals. There's a lot of instances where, you'll get denied for cases for whatever reasons, payers, depending on the time of the month or whatever the case is, but sometimes we'll see higher trends in denials. And then that takes another team just to help with the appeals, just get those authorizations on file. Sometimes there's, payment discrepancies. We are seeing a lot, especially at the end of the year, at the beginning of the new year, where patients are changing their insurances payers. Their insurance plans are changing. So, for example, with a lot of PT/OT groups, we have to do re-verifications. Some clients actually won't even take new patients or actually take anything outside of Medicare patients in the month of January, just because of the fact that there's so many of their patients who are changing their insurances and then resetting and not being able to send us the details in time. So, there's a lot of aspects in terms of what can affect the downstream revenue.
I think one thing that's interesting that we see and we get feedback from the market that a lot of times people don't take into consideration is, when you're looking at a prior auth solution that is going to affect the downstream revenue, how do you contemplate return on investment? And some of the things that you just mentioned, right? Like write-offs, how many write-offs are they having specifically because the auth was rejected, right? And they can't do a retro auth due to their contractual obligations. There's patient abandonment that some of the orthopedics groups have experienced, especially around imaging. If they have to outsource that imaging to a referring physician and that referring physician can't get a timely auth, that patient will abandon that imaging center to go to another one because they've had maybe a pleasant experience there. So I think there's all types of, in appeals for that matter, what does it cost a practice to appeal a denial? And some of those statistics or reports that we've read out there is anywhere from $75 to $150, depending on how complicated that authorization is. So there's different components that definitely not only affect the downstream revenue, but also the cost for that FTE just to process the authorization that falls outside of what they're paying the FTE for the salary.
We also see a lot of issues with coding as well. So, even though you get the authorization and then your billing person goes back and they actually submit the claim, but they use the wrong code or, they wasn't coded correctly, that too has a big effect in terms of their revenue.
And I know that there's, different types of authorizations. I just mentioned one, retro, right, where the claim has gone out without the auth number on it. They know it's going to get denied, but they want to try to do a retro auth to get it approved. But there's also stat and same day, and the turnaround time on that is really important. Turnaround time always bubbles up, but can you just talk about turnaround time when it comes to processing, scheduling a patient, and how prior auth can impact that patient at the time of scheduling?
So some of our clients, they'll go ahead and schedule without the auth on file, and some of them will not schedule until they have an auth on file. So either way, turnaround times are super important, because if you don't have the auth on file, you have the patient on the schedule, you're limited to the number of days. So I always, try to, help our clients is saying, okay, fine, if you're going to wait for the auth, at least know what your payer trends are. Which ones are taking longer to get approval? You'll have some like Blue Cross Blue Shield, some of those Cignas or Anthem, they could take 10 to 14 days to get the auth approved. But if you're only giving yourself a 5-day window to get that auth, then yeah, that's where the turnaround times could get you into some trouble, because the last thing you want to do is reschedule a patient. On the other hand, you have other clients who wait to get the auth on, or wait to schedule until they get the auth, but they're super, they want to get the patient on the books as soon as possible to help with those revenue. So turnaround times are super important. Retros are important as well, like you mentioned. And a lot of times the retros are important because some payers do have some specifics in there that you have to, and especially with PTOT for some reason. But they only allow you, they say that you have to submit within 24 hours. So, and if you don't, then you're only going to get partial reimbursements versus the whole reimbursement, only partial visits. So obviously you could lose a ton of money just on that alone. But then there's stat and same day. So a lot of, especially PTOT clinics, sometimes radiology too, there's a lot of walk-ins. So for us, stat is meaning that we initiate or call the payer within 30 minutes, same day within 4 hours. So if the data service is tomorrow, then obviously we would want to get those worked as soon as possible. So in terms of like the work queue, we do work by date of service, but retros are super important just because of the filing limits for that, stats, and then same days as well.
Very good. We're almost halfway through the office hours episode, so I just want to pause right now and extend to our audience any questions that you may have for Lora or myself. Please feel free to enter them in the chat, and we'll address those questions at any time. So Lora, you're mentioning a lot of these activities up front in the patient access process, and that's really the first time the patient gets to experience who this orthopedic surgeon is and who their staff are. What type of components do the patient access departments look at to measure success?
Definitely patient satisfaction scores. I think every single one of our clients are super involved with making sure that patient satisfaction scores are increased, if not stay the same. But, it depends. I mean, you could have one bad visit and it could throw everything off. So they do look at definitely patient satisfaction scores come first. They want to look for ways, process efficiency metrics. If they're using a tool like a platform like ours or any others, they evaluate the workflows and the processes to see if if it is successful. Is there a reduction in errors? Whether that be on the data entry side, scheduling, or documentation alone. They're looking at financial metrics. How is the prior authorizations contributing to the overall revenue cycle? Is there a reduction in the front end denials? Is there, even with the financial metrics in terms of the data or the time of service payments, collecting those co-pays. We have one client who, during COVID, they stopped collecting. So they'd have a patient come in, or they're doing, the telemedicine visits, but they weren't collecting. They just stopped collecting time of service payments altogether. And so once they started, through us, started collecting again, I mean, they just in the first month or two alone, they were collecting almost $100,000 per month just by implementing this back in. So there's a lot of different metrics that they do look at that actually the patient access team is completely responsible for.
So one thing I think the market's starting, and this is across specialty. I think specialties and staff are starting to become more aware of patient satisfaction, not to the extent that they weren't in the past. It's just become a bigger and bigger deal as healthcare moves more and more into consumerism, right? I know people are starting to use the Yelp app to start to look at physician groups and see how patients have given feedback on that application or to others. Payers are starting to get into patient satisfaction, especially at the hospital level, right? And that affects reimbursement. What do you see as far as patient access departments' plans for improving patient satisfaction? I know you just mentioned some of the processes, but how does that help with patient satisfaction?
Obviously, the patients want to get seen as soon as possible. I mean, that's their whole goal, right? Either, especially if they're in pain or, they need a knee surgery done or just getting that. So getting them on the books as soon as possible, making it as seamless as, as it possibly can be, with making sure, you have the correct insurance details, making sure that you get the authorizations for every CPT code that you're getting that surgery for. Making sure that your staff is knowledgeable. So those ones that are scheduling, making sure that they send them, provide them with all the prep activities that have to be done prior to the surgery that they're coming in for. Revalidating those insurance details, because the last thing you want to have is a patient to be stuck with a bill that they weren't expecting. So I think, proactive communication obviously goes a long way. Setting expectations up front, here's what your patient pay responsibility is. Want to just re-verify insurance details, making sure that you get the auth CPT codes, all the CPT codes for that visit, and definitely making sure your staff is knowledgeable in terms of, here's what you can expect the day of the surgery, here's what you can, post surgery, here's the appointments that are going to need to be done, is there any DMEs that are going to be, need to be ordered, etc. But just making sure you have all your ducks in a row for sure can help with those scores.
So there's a lot that goes on in patient access, and unless you're, in it every day, I don't think you realize how many touch points there are to get that patient seen.
Yeah, one of our clients actually, we did a whole workflow analysis in terms of how many times that they outreach to a client or to a patient prior to scheduling or before they're coming in for the time of service for their surgery. And when we mapped it all out, they were had at least 3 touch points with the patient before they arrived. And by increasing the number of outreaches, some thought it was too much, but a lot of them were just like, oh my gosh, yeah, yesterday my husband changed his job, my wife changed their job, we have new insurances. Like, things like this happen because if you have 3 weeks, a lot can happen in 3 weeks, or they get COVID, they get sick. So it's having those multiple checkpoints before those dates. Again, it matters by FTEs if you have the time or if you have the people that can actually do it. But yeah, it's definitely important.
So there's a lot of responsibility for a patient access director. I mean, you just mentioned a lot of things. What should an orthopedic group or patient access director look for in a patient access solution?
Definitely. I mean, I think it's important, as we've even grown as a company and expanded our specialties and, what markets we are in, it's important to have one, that you have a tech-enabled solution. So it's not pure services is one thing. 2, that they have knowledge on those modalities, right? So if you're doing viscos, if you're doing surgeries, if you're doing radiology, like if you find a solution that can actually do it all, that they understand the nuances with initiating an authorization for surgeries or for visco, which portals to use. You want to make sure that the platform that you use can do, it's a one-stop shop, right? So you can check eligibility and benefits, you can get your patient pay estimations, insurance discovery, and then the analytics side. When we onboard a lot of clients or even through the whole prospecting phase, you can ask, how many authorizations are you doing per month? They have no way of knowing, they'll go into Athena, ECW. There's no way of pulling that data. So having a solution that gives you some really good analytics that you can utilize in terms of your report outs. You can see who your top referring physicians are, your top CPT codes, top payers. There's so much data that we receive, and being able to visualize it and see it actually goes a long way. It's life-changing for a lot of these patient access directors because they didn't have visibility into this previously.
Right. It's a great point. You can't effectively manage if you can't see what's going on or the holes within
Yep.
the process.
One of the data readouts that we have in our analytics dashboard is actually shows payer trends, which helps them tremendously because it shows you which payers are taking the longest to complete the authorization. And you'll see there are some heavy hitters in terms of the ones that take the longest, but they also go back to the payers to help negotiate, right? So they're saying, hey, this is like not part of our contract. Like this is taking this long to get these, or our web portal access is restricted. We can't check follow up on here. We don't see the authorizations. We're not getting the denial letters. There's so many things that they go back to help negotiate. So some of this data actually does go a long way for them.
So what are some of the types of challenges that should be expected when you're implementing a prior auth solution? I know from the sales perspective, there's a strong trust in customer success, and you fill out a form, and from our perspective, customer success takes over, and within
wow
90
way to minimize what you guys do. Yeah, not very helpful.
Mm-hmm. So could you tell us a little bit about maybe some of the challenges that customers should expect? Because when you're going to implement
some of the challenges when sales hands it over to customer success, that we realize there's some gaps. Yes, I can help fill in those gaps. One is obviously you're talking to different people, when you're through the whole processing phase. And then once the contract's been signed, then we talk to the actual doers, right? They know the prior auth process is better than anyone else, but they weren't actually asked, as people, some of these organizations are looking for new solutions. Like they're not asking them, hey, how can a solution help you? What do you need? So sometimes the people we're talking to at first don't really know the prior authorization process. And then we find out, hey, our system can give you no auth required in real time from our machine learning AI, but then we find out, no, they actually have to re-verify any NAR that we provide. They have to have a reference number. They have to have the first name and last name of the person, last name of the initial of the person they spoke to at the payer, who they called. They need all this documentation because they keep getting denials. So there's gaps within the process that maybe we weren't notified from the very beginning, that kind of slows things down. Some clients, believe it or not, don't have a lot of web portal access. And so that's going to slow things down in terms of the automation perspective. We create bots, right? Our bots go in there and they scrub the portals. We're looking for updates on cases that were initiated. But if you don't have web portal access, everything falls to fax or calling, which are ineffective in both ways just in itself. You could talk to a payer and they give you wrong information, or you have to call 4 or 5 times in order to get someone who actually gives you the auth number, when they keep saying it's no auth required, no auth required. But our client has said an auth is always required. So those are kind of like the main two things. Like initially when we onboard, we're seeing some gaps. It's just like one, the knowledge of what the billing manager requires from the prior auth team, or some different nuances. No client is the same, regardless if we work for an ortho client in California versus one in Boston, Massachusetts. Everyone has their own processes. And so it's kind of like relearning, because we're here to kind of support that. We don't want to create more work. We're trying to basically, replicate what you're doing, not cause more frustrations or any issues with us creating new workflows for you that's unnecessary.
So you brought up something that's interesting, that it happens in discovery, I think, when you're onboarding a new customer, which you just touched on, but it's connectivity. Connectivity is super important because of the payer portals, direct connects going through the benefit managers, what have you. What should a prospect be asking the prior auth vendor about connectivity, especially when it relates to onboarding?
Let me ask you. That's a great question. What questions do you get asked about connectivity from your prospect? A lot of the questions are, do you have direct connects, or how many payers are you connected to?
Those are really the two main questions that we get asked during the upfront sales cycle.
Yeah. So the great thing about having those integrations is obviously you get real-time notifications, right? We know that no auth is required for this CPT code for this payer using these third, party benefit managers or through the direct connects. However, this is kind of what I was talking about before. Some of the challenges is that we can give you those real-time no auth required, but a lot of these ortho groups, just because of the denials and some of these payers, they actually need some type of reference number or a transaction number. So through the connectivity, we can provide that, but sometimes we have to take it up a level where the connectivity doesn't even matter. It really depends on kind of the workflows internally that the ortho groups have. So it is important. It helps get, the authorizations turn around pretty quickly, but it also depends on workflows, internal workflows.
So so said differently, if you don't have a patient access prior auth solution, everything is manual. There's
pretty
really
much
nothing...
everything drops to manual. Yeah. So if you don't have a platform, you'll still have your access to your web portals, but it's your people who are sitting on the call waiting for 3 hours for Blue Cross Blue Shield to answer the phone when they could be checking in patients, when they could be scheduling. There's other things that they could be doing versus these mundane tasks of getting an authorization approved. That's usually the reason why that people look to outsource, is they just don't want to have their FTEs. And sometimes there's nurses that are doing the authorizations. Those nurses could be better utilized versus doing the authorizations. So not having any type of tech doesn't, it definitely doesn't help.
So, just to kind of recap that, and we're coming to the bottom of the hour, so I just want to remind our audience, if there's any questions that you may have, please go ahead and put them in the chat, and we'll get to them. But just to recap what you've said, when you look at the manual process, you're having to staff up for your prior authorizations to keep that turnaround time in a manageable state. If there's churn, then you're going to have staffing problems that won't be able to address your current volume, which is going to cause backlog. Like you just mentioned, nurses, right? Nurses shouldn't be doing prior authorizations. They should be redeployed to take care of the patient. That's what their main job and focus
and their high wages. Exactly. You're paying them double, triple of a prior auth specialist to do the same exact thing.
Right. And if you're doing a manual environment, more than likely you're going to have higher denials, higher write-offs, and higher patient abandonment. So to have a platform that can streamline those processes, give analytics to the patient access director, to the staff, so that they can see exactly what's going on within the prior authorization process for the first time, really, because they've never had a way to manage it electronically. There's just a lot of benefit to what you described. We do actually have one question that just popped in from an audience member. It said, so when you look at the entire process from patient access to collection, every step of the patient journey is linked to that initial engagement with the patient through collection to reimbursement. What advice would you give in your experience on how to streamline that process to optimize reimbursement and increase patient satisfaction? We kind of spoke to it, but maybe
that's a long question.
just from your experience, I guess that they're wanting to know, what is it that can optimize reimbursement and patient satisfaction through automation?
So hopefully I remember the questions all together, but definitely you want to implement, ortho groups want to implement strategies, just to help optimizing their entire patient access workflow, right? Finding a platform that can do eligibility benefits, patient pay estimations, insurance discovery, prior authorization, all within one case. So you're not going to multiple portals or not going to multiple software systems, or, obviously these things can't be done with your EMR. No EMR can do all this itself. Enhancing your communication with your payers. Sometimes it's a matter of having your contracting people going back and renegotiating, or, helping resolve some of the issues that your staff or even a vendor like ourselves are going through. It's like, it's all impacting patient care, which is what we have to be mindful of. Definitely leveraging technology, streamlining those administrative tasks, and just maintaining accurate, thorough documentation, even with denial trends, like making sure that you guys are capturing, why do you keep getting denied on the front end for these specific, by this one doctor? It's because conservative treatment wasn't met. It's not medically necessary. Or, the way that you're initiating the cases or sending the cases, all the clinicals weren't included. So there's a lot of things that can be done to help, experience and streamline the process, but to get those reimbursements up. And obviously want to help increase patient satisfaction scores, but I think overall.
Great, thank you so much. We're actually at the bottom of the hour. We've addressed a lot of what takes place up front to optimize reimbursement on the back end. We will be having another office hours segment on specifically what Infinx can do to help with AR follow-up and capture the reimbursement that the physicians are rightly due. But until then, this wraps up another session of office hours, and I want to thank the audience for joining us today. And again, thank you for your insight, Lora. It was very helpful.
Thank you.
Have a good day, everybody.